Mental health problems in British prisons. There is a significantly high incidence of mental health problems among the UK's prison population. The House of Commons in a report on mental health in prisons outlined the scale of the problem by highlighting the elevated levels of self-inflicted deaths and harm in prisons as well as the generally deteriorating condition of the country's prisons and understaffing problems. In particular, it has noted that increased availability of drugs in prisons has contributed to the increase in mental health issues of prisoners. The poor coordination and a lack of sharing information means that prisoners are not receiving continuity of treatment as they move between prison and the community. This is viewed as a disgrace as too many prisoners are having to wait far too long to be transferred to hospital or secure units. Di Vigiani makes the argument that the idea of healthy prisons is an oxymoron considering that they are places of disempowerment and deprivation. He goes on to argue that emotional and psychological survival partly depends upon an individual's ability to tolerate the deprivations of prison. Most prisoners, however, come from the poorest or most socially excluded tiers of society and often have the greatest health needs. Prison may, therefore, be the worst place to send them given that, in the main, they are likely to be highly vulnerable or susceptible to poor health. While the UK has made efforts to incorporate imprisonment and healthcare provision, the problem has been exacerbated by inefficiencies in the management of drug misuse, suicide, and self-harm. The broader needs of the prison population are also being ignored, especially with regard to physical ailments such as epilepsy, asthma, coronary heart disease, dental morbidity, and infectious diseases that may have an indirect effect on mental health. Other factors that impact mental health include intimidation, violence, and bullying, most of which are again often not adequately addressed, often due to understaffing. There is therefore a need to reorient prison life to one where mental health is a priority, which will finally make the term prison health a meaningful concept. Another perspective on the reasons for a high incidence of mental health problems in the UK's prison population has to do with the government's austerity measures. This has resulted in chronic underfunding of public services such as prisons. These policies have reduced state funding of the prison and probation service by 22%, from £3.47 billion between 2010 and 2011, to £2.71 billion between 2016 and 2017. Persistent wage freezes have also demoralized public servants, including prison staff. Austerity's underfunding has therefore impeded government initiatives such as the Healthy Prison Agendas from achieving its objectives. These problems have led to calls for alternatives to imprisonment, especially as the UK already has the highest incarceration rates in Western Europe. This is especially necessary as the system is already buckling from underfunding. While the prison service is understaffed, staff are unable to provide the level of care and support that mental health prisoners require. For example, prisoners have been found to miss an average of about 15% of medical appointments simply because there is not sufficient staff to escort them. The problem is amplified with aging prisoners suffering from mental health issues. They require higher levels of care for which there are often not the necessary staffing levels. Another key problem has been privatization, which has resulted in staff and conditions being cut, in an attempt to maximize profits. This hurts the delivery of healthcare in general, and mental health care in particular. Improving the situation therefore requires a number of factors. One improvement is for the government to understand the scale of the problem, as the National Audit Office has reported that the government does not know how many people in prison have mental health problems. This requires increased screening methods to identify those with mental health needs. Another area is an expansion of the process where people in police custody and the courts have access to liaison and diversion services, so that mental health needs are addressed prior to entering prison. There is also a need for greater investment in community sentences, so that those with mental ill health can access services without having to go to prison. The transfer process in prisons needs to be upgraded, so that no prisoner needs to wait more than 2 weeks before accessing urgent hospital mental care. Also, the government needs to ensure that everyone leaving prison with mental care needs can access health care in their communities. Finally, the UK needs to adopt a less punitive approach to crime. which results in a disproportionate number of offenders with mental health issues going to prison, rather than clinical facilities. Only through a radical new approach can Britain's problems with mental health issues in prison be properly dealt with.